Hi, I'm Dr. Wegman. I've been in practice for 18 years. We have 3 doctors in the clinic here with us, and we specialize in spine health. We help people regain their quality of life. One of the things we focus on is improving the way the spine functions and educating people on how to take care of and maintain their spine as they age. There's 2 main spinal issues that we focus on as people age. One of those is known as a de novo scoliosis, which is an adult scoliosis where there's a lateral shift in the spine that's starting to affect quality of life. And the other one is a kyphosis, and you see that when people are leaning forward. And as we age with the gravitational forces, spine injuries, and also degenerative aging spine issues, we start to see the postures change in patients. So we really focus on addressing some of those issues to be able to help people improve their quality of life. The way I see it, you have 2 options. You can continue to live in pain, which often is not a good plan because that pain increases. And the other option is to learn some of the techniques we have for strengthening and bracing the spine. We have the ability to build a 3-dimensional brace that is custom built to a person's issue, and it's custom built to their spine. So what we do is we merge 2 technologies. We merge digital x-ray and we merge 3-dimensional scan with an iPad, and I'm able to scan a patient, and with that scan and the x-rays, we're able to send those into a company called Spine Tech, and we can build custom braces to allow people to have the quality of life, the freedom, and the movement that they've wanted as they age. Well, one of the main benefits of bracing is preventing further degeneration or decay of the spine. In the adult scoliosis, the de novo scoliosis, the spine can deteriorate, which means that the curvature in the spine can increase from 1.5 degrees to 2 degrees per year. At that rate, it can become debilitating and sometimes cause people to have major issues. So one of the red flags that I look for is when a patient tells me at 4 o'clock, 5 o'clock in the afternoon, they can no longer stand, they can barely make dinner, they can't do the dishes. And so that's a big indication that the spine is starting to limit their quality of life. And so what we do is build spines to be able to help that area of life when it starts to get tough. So what we do, merging the custom technology, is we take the 3-dimensional scan of a patient, we match it with their x-rays, we send both of these out, and then what we have is a custom brace built to make specific corrections to what we're dealing with on the spine. The drawback to bracing is if a patient becomes dependent on the brace, they can start to lose muscle mass. And as a patient ages, losing muscle mass becomes very important to monitor. So what we do with the braces is we build braces to fill a certain area of life where the quality of life is starting to struggle, and then we teach the patient how to strengthen their spine to be able to improve their mobility, their function, and the things that they like to be able to do without losing muscle mass.